Hi, everyone. Welcome to AOPA's Advocacy in Action webinar. We're so excited that you could join us today. We have Terry Cuffle joining us from Arise O&P, and also serves on the AOPA board, is our advocacy chair, is our vice president. It's just so wonderful to have you joining us today. Would love to welcome you, Terry. Would you like to introduce yourself?
Sure, thank you, Ashley. Can you hear me okay?
We can.
Okay, super. I wanted to say thank you for having me first and foremost. It is always a pleasure, and I feel like this is more, hopefully the tone of this webinar will be more of a casual conversation amongst colleagues and friends, you and I, because we have been together working this advocacy beat with AOPA for, I would say, I think the longer of 12 years or so. So it's been a journey. So who am I? I'm Terry Cuffle. My husband and I and our partner Kevin own Arise Orthotics and Prosthetics in Minnesota, Spring Lake Park, which is just north of the Twin Cities. And we've been in business for about, I would say about 12 years now, 13 years. And I am on the board for AOPA, current vice president. Love the work that we've been able to do on the advocacy side of AOPA for the past 10, 12 years. And I am also on the board for the Minnesota State Association and also Wiggle Your Toes, our Minnesota amputee nonprofit. Very proud of all the work that I do. Oh, and also I'm an instructor here in Concordia, St. Paul for the graduate students, for the O&P graduate students. So I wear a lot of hats, but I thoroughly enjoy doing more than just the day-to-day in O&P. Thank you for having me.
Thank you for being with us. So we met for the first time, at least I can remember meeting you 12 years ago at a state reps meeting. We were both state reps. We were both excited and engaged. I was formerly, before joining the team at AOPA, ran a 5-facility patient care group with my father, and so I had the opportunity to serve in a different role, and we met there, and I think it was really encouraging to see enthusiastic, excited individuals that were thinking about the practice of O&P and the patients, and in this way, what needs to happen in terms of policy in order for us to move the profession forward, and that was always what we did at that state reps table, and so. It's just really wonderful to be still working with you in this capacity all these years later. So I just think it's a neat story. And I'd love to hear a little bit about your first time meeting a member of Congress, just for the folks that are joining us that maybe haven't gotten involved yet with advocacy or outreach efforts. And you might want to share a little bit about your first experience.
Sure, I'm happy to. So we actually started working in Minnesota through our state association at our capital here about the same time that I started attending the policy forum in Washington, D.C. with AOPA. And so, and I was super excited to be able to do both. So my first grassroots experience really was here, boots on the ground in Minnesota. We were working the Minnesota O&P licensure bill, and at the time it was called the parity bill, both of them, or insurance fairness. We ended up, it took a while, but after several years, we got the O&P Licensure Act passed. And so that was super exciting. And to be able to do that, the grassroots advocacy, pulling people together. We worked a lot with Wiggle Your Toes in our state association. Together, we had a Hill Day here. And we started to realize the importance of having amputees in those meetings with legislators. And so I carried that over and brought that to the AOPA Policy Forum. And I'll never forget that my very first visit there, I was able to bring Nick Nelson, who was an 11-year-old bilateral above-knee amputee, and his mom. And Charlie and I also brought our 2 older children who were about the same age, so Nick would have some people of like mind to do that journey with. And we had probably 6 visits scheduled, and Nick was the center of attention in every one of them. And Congressman Paulson was probably the one who, Eric Paulson at the time, made the most impact on our visit. He really scooped those kids up, and he actually even brought them on the floor to cast votes for him. There's a rule in Congress where you can be on the House floor if they're 13 or younger, I believe is the age, they can accompany a congressperson. So he made such an impact on our visit, and we made such a great connection early on with him. And then for literally the next 10 years that followed, we have had such a strong relationship with him. So our grassroots started in Minnesota, maybe a year or two before we actually ventured on to Minnesota. And then through Wiggle Your Toes, we've been working with having amputees join us on every single visit I have ever made in the last 10, 12 years to DC. So, and we have found that those visits are more impactful, and we also get a lot more face time. On that very first visit, not only did we meet Congressman Polson, but also Senator Amy Klobuchar made it a point to come out and meet us in person. So lots of really great stories over the years. That was the very first visit, and I believe it was 2010 that we made that very first visit.
Yeah, it's such a it's fun to think back about, you know, where we were, who we worked with, and now noting you know, that we still are in touch with a lot of those individuals, a lot of those staffers. All of that legwork really matters down the road, and we'll talk a little bit about that later. But thank you for sharing. And you know, with our legislation introduced in both the House and Senate, we thought it would be a great time to share with our attendees about the different ways that AOPA members can get involved in advocacy, and what those specific types of involvement look like, and even some of the kind of behind the scenes stuff that maybe people aren't aware of. And I'll share my screen shortly, and we can look at how we actually do some of the brain work that goes into the types of outreach, the different types of outreach. So I'm going to start by sharing just some general terms. So you may have heard about grassroots, and we talk about grassroots, and people say, well, that just sounds like you're trying to, you know, you're organizing on the ground, and it's exactly what it is. But it is more of a blanket approach. It's more of getting the numbers that we need to show interest. So we heard when we first introduced in the House that we were going to need plus 100 co-sponsors on our bill to have it heard in committee. Our committee of jurisdiction is the Energy and Commerce Committee. We have 4 members from that committee very actively engaged with our legislation. So we know that it's a priority in the committee, but in order for it to make it to a hearing or to actually be heard and pass out of committee, we need to gain a lot of sponsors. And so that grassroots letter writing and social media and call campaigns, all of that is to create an increase in those numbers of sponsors. So when we say grassroots, we're really trying to get as many constituents as possible to just put it on their radar, because it's our job on the other side to go in and give them all the information that they need to show that it is a priority for the constituents that they represent. But those constituent voices are so important to this equation. Like you said, individuals that can provide examples of how it will impact them directly, so patients, are so important, because they connect the dots for folks right there, right in the moment. Grass tops is another term that you might have heard in terms of advocacy. And this is when a key constituent reaches out to a member of Congress or a member on the staff, and they say, hey, you know, this is really important to me. Now that might coincide with fundraising efforts, attendance at those fundraising efforts from those individuals. That's a piece of this puzzle, but it's not the only piece. Someone that's really involved in their own community, even if they're not a financial donor, but they're active in maybe in their community government, city council, any type of person. I mean, we have our very own mayor of Owensboro, who is an AOPA member, Tom Watson, longtime AOPA member and very active key constituent for us in Kentucky. Those types of folks make an impact because they have developed relationships. They're from the community. They have a voice that matters, and they often can contribute to a person being able to get reelected. They're just going to be a supporter in that way, and that's why their voices matter. So those grass tops outreach, it's really about that personal connection, and building a network of those individuals is really important for AOPA and for our activities. I'll pause there. Joy, I haven't stopped to ask if there's any questions. Or do we have any questions about anything so far?
Not anything so far, but it's a good reminder that if you do have a question, pop it into the questions field, and we will pose those to Terry and Ashley.
Yeah, thank you for that reminder, Joy. So the next piece of this puzzle is the lobbying activity. And man, lobbying comes with a heavy weight these days. People are really hard on lobbyists. And as a registered lobbyist myself, I take that very personally. I did not come up through the ranks with the intention of ever being a lobbyist. I very firmly consider myself to be a health policy person. I care about this profession. I want to advance this profession in whatever way I possibly can. But I've been doing advocacy work for a long time, and registered lobbyists really are just individuals that spend a certain amount of their time with members of Congress. So because I spend a certain amount of time with members of Congress, I am required by the federal government to register. So that's really all it means. It's just a way for reporting that time spent and those resources allocated towards elections. And that's why people get termed lobbyists. And those lobbying activities are really important. So as lobbyists, we schedule meetings with the staff. We provide constant check-ins to explain the different details of the bill. We make sure there's no opposition. If there is opposition, we work with those entities to make sure that they understand the intent of the bill. So we're kind of always kind of following along each piece of the puzzle to make sure that things move forward. And then also we have a regular sort of check-in schedule as a group to make sure that we're all on the same page and sharing the same message. And so we have, in addition to me as an internal lobbyist for AOPA, we have a firm, Austin & Bird, that we use as external consultants, and they very much help us keep those constant meetings. I mean, I have upwards of 10 meetings on my schedule every single week that they're helping us confirm. So a lot of work goes into the sort of behind the scenes pieces there. And then health policy work. This is those pieces that substantiate what it is that we're asking, why we might have a health policy position in the first place. There's either some evidence base that supports that, research has been done, and we've learned that the evidence shows that really this is the way it should be done. We also know that we have a lot of input from you all in practice and what you experience every day. And so when we hear those stories and stories of our patients, trouble with access as an example, it's really important to be able to put those pieces into digestible bites so that we can present those to members of Congress. So all of this together really makes that's really the formula for building an advocacy approach. And I'll pause there. Do we have questions on any of that, Joy?
Not yet, no.
Okay, great, thank you. So if you've seen any of our social media posts or emails that are encouraging you to take action and write your legislators, that's grassroots advocacy. And if you haven't yet completed any of those activities, I will share with you what that looks like right now. So I'm going to share my screen. Flag it for me if you cannot see my screen, but sharing right now. So this, the legislative and regulatory page of AOPA's website, is a great resource for you to go find the information about our current bill that's been introduced in this House and Senate. You'll see the bill numbers there. You'll see the sponsors. There's links to the Senate bill backgrounder. That's actually the one pager that was written by written by the senators, the key senators on our piece of legislation, Warner and Daines. We also have a press release here. These are all pieces that you can share with your community. And then we have the talking points. They're all right there on the page. But if you've seen, this is what we've posted in those social media posts and it's AOPA votes. And so we're going to go to AOPA votes now, so you can see the action center. You can see the call to action. If I say act now, that's going to walk you to this very simple page where you'll put your name and your address, your zip code, your phone number, and your email. And when you click send email, it will open up a piece that will allow you to put your own story in to ask your senator to co-sponsor the bill. Now, in the case that your senator has already sponsored the bill, it will be a thank you letter as opposed to an ask your senator to co-sponsor letter. That thank you letter will show the gratitude that constituents have for those for that championing that those senators have done for us. The same format works for the House side as well. So that's just a little bit about when you see act now, or add your voice, all of those calls to action. That's what we're talking about. We're talking about you adding your name to this system so that we can put it on the radar of those members in the House and Senate that have not co-sponsored the bill yet. And then there are other pieces to this puzzle. So we have an action center. This is that behind the scenes piece that I said I would share earlier. So we want to thank our current, most recent advocates over here. You'll see our advocate activity. You'll see the number of advocates and the connections made. Connections are equivalent to pieces of outreach. So the reason that number is significantly more than the number of advocates is because you've got 2 members of the Senate that represent you in your states. So that's, double the number. And then it goes from there. Your member of Congress may change from one, with elections and special elections. So you may add a new member of Congress. If that's the case, it's always important for you to reach out to that office. Again, we'll see that we have top states here. These are the individual states with the most outreach that we've seen. So this is like our dashboard. This is how I kind of dig in and figure out, where do we have a lot of activity? Where can we focus our outreach on the Hill? All good ways for us to tailor that outreach as well. I'm going to put Terry on the spot here a little bit and just share her report. So Terry is a key constituent. She has personal relationships with members of Congress. She's also a PAC donor, so she gets acknowledged there. You'll see those tags. But she has completed every single call to action that we've launched through this platform. So thank you, Terry, for your continued and constant advocacy on behalf of AOPA. And this is just, this is just a way for us to make sure that we are bringing forward those active voices, that we know who's engaged and who's involved, because those are the members of Congress that we're going to want to focus on. And when I say those are the members of Congress, I actually mean that we have another way, another piece, another tool that we can use to look at that member of Congress. So you'll see here, this is Terry's member of Congress, Tom Emmer, and there's a lot of information in this platform that we can use to help us build our arguments, things that we hope he will be interested in, ways that we can connect with his staff. So we have his bills and votes all listed here, the district info. I showed this to Terry earlier. I mean, this really gets down into, you can see what he's voted on, how he's voted. This is not work we expect you to do. This is work that I do in support of our outreach efforts. But you can see here that it covers the district, so you'll know what cities that are included. You know exactly where who you're talking to and who they represent as constituents. You can learn a little bit more about the district itself, the industry that people work in. So in areas where they have high healthcare industry, a lot of times those are the members of Congress that are involved in healthcare committees. It's something that it surprised me when I saw all this behind the scenes and background information. It helped me better understand why our advocacy outreach is designed the way it is and how it works. And then our staffer information. So these are the people that we're constantly reaching out to, trying to build relationships with to support AOPA in its to just get it on the desk of the member of Congress. So I'll pause there. Again, you can see even their specialty. Their title is often related to the area of focus that that individual staffer has in Congress. I will pause from sharing my screen for a moment and just say that that is a little bit of the behind the scenes. And, you know, I'm always happy to share more of this with you all because I think that that's what helps us build a more robust advocacy platform together, for sure. I don't see any questions. Joy, do you have any for us?
No, I don't, but if folks either want to drop them in the questions chat, if they have that, or if they want to try and raise their hand, I can try and unmute you if you wanted to ask them verbally as well.
Yeah, we encourage you guys to engage if you have questions. Like Joy said, she'll unmute you if she can, and we'd love to hear from you. So I'll keep going. I'd love, Terry, now, if you don't mind, sharing a little bit more about Congressman Paulson.
Sure.
We talked about those grass tops, that key constituent outreach, and would love to highlight Aaron Holm and his story also.
Yes, absolutely. So I believe Aaron is on the webinar. I hope he is anyway, because I'm going to talk a lot about him right now. First of all, I want to say thank you, Ashley, for bringing us through that behind the curtain scene, because it's really fascinating. I had only seen part of that, and the access to information that you have is an integral part of this entire process, the grassroots advocacy campaign that we create. And I also want to stress that I have realized over the last 10, 12 years that I am only a part of the puzzle and the bigger picture in the grassroots advocacy. I can help bring people together. I can help by responding to an AOPA vote and a letter. I can help by picking up the phone myself. I can help by bringing people to Washington, D.C. to be at those meetings, but I'm only a part of this big picture. And some of the people who I have worked with over the past years have made an incredibly large impact on several of our Congress people. Aaron Holm is one of them. So my work with Wiggle Your Toes, the amputee nonprofit in Minnesota, is, I like to always say, the best work that I do. Working with Aaron Holm and Rob Rickenberg specifically, and the advocacy work we have done both in the state of Minnesota and in Washington, D.C. has effectuated some significant changes in the O&P community, and we're super proud of that. But I also realize I'm a pretty small piece of that equation, because when the first time that I asked Aaron to join me at an AOPA policy forum, okay, all right, fine, I'll come. And sure enough, he and Congressman Eric Paulson hit it off like that. And so much so that in subsequent years, I would go to DC without Aaron or Rob, and I would call Aaron and say, okay, I'm gonna visit Paulson tomorrow, and I'm getting the runaround with, I may be there, I may not be there, with the staffer. I said, can you get him on your bat phone? Can you get him on the bat phone and tell him that Minnesota's coming, and even though you're not there, we'd like to see him in person? And sure enough, he would, and he'd get a response instantly, and then lo and behold, we would see Congressman Paulson the next day. Aaron has been able to establish really great relationships with a lot of our legislators, and that's just one of them. And then Rob Rickenberg also is someone from Wiggle Your Toes that I have ventured with. He likes to call us the peanut butter and jelly of that legislative advocacy beat for Minnesota. We've done a lot of trips together, and he is from the same small town in Minnesota as Congressman Emmer, who is now the congressperson for my district. Didn't grow up in the district that I currently live in. He did not, but he and Rob have great connections and great background history and know so many people in this small Minnesota town. And so it's really great for us to be able to go to DC and have that connection as well. And so both Rob and Aaron are amputees, and they're both founders of Wiggle Your Toes, that amputee nonprofit, and bringing them in and having them sit with our Congress people and saying, this is how this bill affects me. You know, I'm the one who needs care. I'm the one who needs to be access to the care that I need and it's unique to every single amputee. So bringing them in and having them tell their stories. And I started with Nick Nelson, who was, you know, a bilateral above knee amputee who was a child at the time. And his mom was so concerned about what does his life look like? How is this going to affect him? We need policy changes now so he can get the devices he needs as he grows into an adult. Because years ago, and potentially still in some states, there were some policies that said, you know, one leg per life. That was it. Well, he needed 2 right off the bat. So, you know, it's, you know, to tell that story and to have them be there alongside me, I realized very early on that I'm just a piece of the puzzle and I can help, but these people who have, you know, have journeys that they can really share impacts our legislative campaign at a level that I couldn't do alone. All I could do is tell them a story, and that can be good enough to get you in the door. But it really has made some significant changes in Minnesota. Congressman Paulson he's no longer in the House. He's back in Minnesota consulting, and he actually will be at the AOPA Policy Forum. He's one of our keynote speaker this year. We're super proud of that. And the work he did with us it was probably a good 10 years of work. And he was an instrumental part. He was on a committee with the House Ways and Means, and at the time was a critical part of one of our prior bills. And when we got that, the patient care notes, our practitioners' notes passed that part of the bigger bill that we had, he was instrumental in doing that with us. So really kudos to him and to us, all of us, the Minnesota team, Aaron and Rob specifically for that journey. And, you know, realizing that your part, don't ever get frustrated that the letter that you wrote or the call that you made or the visit that you made wasn't impactful. It is all just a part of this larger journey, this bigger picture, this advocacy campaign that it is just integral that we are all a part of. And just be the part of the puzzle where you can lend that helping hand and then sit back and watch the advocacy and watch what happens behind the curtain. Ashley, that was amazing for you to share that, and certainly I think really helps people realize that you know, where their position is in the grassroots advocacy picture. The grass tops that you're talking about, Aaron and Rob are grass tops, perfect examples of grass tops. You know, I'm not a grass top. Maybe Ashley has me listed as one because I've been doing this for so long, but I consider their connection more important, quite honestly. I can schedule the flights and the meeting and get them there, and I can open the conversation and I can close it and I can talk the policy piece in the middle of it, but they're the ones who really help effectuate the change that we're looking for.
Yeah, thank you, Terry. And you're right. I mean, this work that we're able to do, it relies on all of the pieces of that puzzle, and it relies on us having active constituents, and that includes the patient voice. I don't think it's complete without it. It's really good to point that out. And then, you know, Aaron is a key constituent. He is someone that we reach out to regularly when we need his help, and we're thankful for all the work that he's done to help us to share our message on the Hill. And so I wanted to follow up a little bit about how that organizational piece, the lobbying piece, is so important. And so we had Senate introduction. I'm going to tell the story, and I don't want it to come off as like weird, except that it is. Congress is weird. We were waiting for so long for Senate introduction, and we were like, but wait, everything's there. That we have the bill, we have it from Legislative Council. Like literally, the only thing left to do is for Warner to go and introduce it, to actually make the bill be real and give it a number and all, you know, all of the pieces that happen. And we learned even that is as much as sending an email now, because of everything with COVID and the way that everything's working in Congress. It is not what you might imagine, you know, like a piece of paper being walked down to the floor, and there are formal introductions of bills that happen that way, but it's not the only way. And so learning kind of that piece of this puzzle, and then being like, well, why is it not introduced yet? Why are we still waiting? And then we found out that our key sponsor, Senator Warner, it was part of the negotiations on several really big things that were moving in Congress. He was instrumental in those infrastructure discussions, in those infrastructure talks. So his capacity, his ability to pay attention in the moment was limited. And so that's when my job really got hard, because now I'm responsible for making sure that we don't miss our opportunity. We wanted to make sure we had introduction prior to recess, prior to the time when members of Congress take their vacations. Usually that's in August, and that is accurate for this year. It always fluctuates depending on what's being debated, needs to be passed in order to keep the government functioning. And in this case, infrastructure was just a primary focus, and Warner is very much involved. Senator Warner is very much involved in that. And so every single day I was reaching out to offices, when is this going to happen? And our partners were reaching out as well. And so that work it's almost nail biting. You're like, oh, when is this going to be introduced? Why has this not been? People are asking, AOPA members are emailing me, where's our Senate bill? Why hasn't this happened yet? And so I have a new respect for the work that folks do to keep these issues on people's radar, on our members of Congress' radar, so that things happen. And so I will leave the lobbying pitch to you all at that, but it's important to note. Terry, any thoughts about that? I mean, you've seen me kind of go through the transition, and I'm interested in what your thoughts are.
Yeah, well, I think it's incredibly cool that you're a registered lobbyist now. I think back 12 years ago when we met, and I remember my first impression of you was, wow, if we have more young people, we were younger then, right? We have more young people like Ashley in this field, we have such a bright future. And so now, I have considered myself a hobby lobbyist because I'm not a registered lobbyist, but I am an attorney. So I have that fine line to getting there, but I'm not registered. But we've talked about hobby lobbying all this time, which is something you and I both did for years, and now you're registered. So it's awesome, the journey that you have taken and the responsibilities that you have taken on and the commitment that you have to this advocacy campaign for AOPA is really very impressive. So we thank you for that.
Well, and I'm not the only one. So we have our team at Austin and Bird, and you've had the opportunity to meet those, to meet that group. And so I would love to, know your impressions of them and their work, because you've been able to work with them, through different intervals for a long time.
Sure. We have had outside consulting and lobbyist firms that AOPA has worked with for the last 12 years. Every AOPA policy forum that I have attended, we've had someone speak to their work for AOPA. And it's really important to have those people who are fixtures in Washington, D.C., who walk that legislative beat, that lobbying beat, and understand policy and how the sausage is made in DC, because we don't, to think that our bill had to be in Ways and Means and then Energy and Commerce has nothing to do with healthcare. So, and those are pieces of the puzzle that we need lobbyists and outside experts to be able to help us with the journey that we take. Obviously, we're working with Medicare and the federal government, and there are so many laws and rules, regulations that we have to weed through to find out how we can pass a bill, present the bill, pass a bill, and make sure we cross all those T's and dot those I's. So working with Alston and Baird and several others over the last 10 years has been critical for us. And it's really nice that we have both Mike Park and Mark Rader. They have been constants for us for years. And so we have their help now, and they continue to work with us and have worked with us over the years. So that, again, we talk about being part of the bigger picture, part of the teamwork, and how each person is instrumental in building that program and the advocacy campaign that AOPA has built over the last 10 years.
Yeah, thank you, Terry, for that. I agree. I've learned so much more about the work that they're doing for us, and appreciate having them to support these efforts, to make our presence bigger. You know, every other healthcare industry has it. Healthcare is the #1 spender in lobbying in the United States, and so we think our voice is small, where our voice is small in our own space as well. So it's good to have that added power behind us. And some other folks on the Austin and Bird team are kind of incredible. We have a new team member. Her name is Jane Lucas. She's part of that Austin and Bird team as well. She's going to be speaking at the PAC reception at the AOPA assembly. So for those that are coming to the assembly, should know about her. She formerly worked in the administration. She worked under at HHS as an appointed member of the administration. So just a really incredible individual that really understands the inside and out. She was also a key healthcare member of the Senate for many, many years. She worked in committee staff as well as in the office of Senator Thune. So just so much experience there that she has and brings to the table as a partner for AOPA. Do we have any questions? I don't think I see any, Joy.
I don't see any either.
Okay. Well, I finally just want to take one more opportunity to highlight the importance of our health policy work. And I'm sure that folks have seen that, my title is the Director of Health Policy for AOPA, but the work that's being done to support our ability to say we have these health policy positions is really happening at the research level. It's happening in the community as we gather those stories that Terry highlighted, building that toolbox of anecdotal and experience-driven stories. They're relevant to those provisions of the bill. And this actually changes in terms of how we post certain talking points for members of the community when we find out that there is something that's impacting our members. So I'm going to use same or similar denials. Same or similar denials really, it originates with the reality that we live under the DME category. O&P is lumped in with DME. And so we look at all of the challenges that same or similar causes O&P practices. And we look at the provision, the first provision of our bill to distinguish O&P from DME. And all of that challenge to same or similar, that challenge lives in the medical supplies section of the Social Security Act. So the reason that impacts us so much is because it's applicable in this very specific part of the Social Security Act that governs the DMEPOS benefit under Medicare. And so we took that and we said, okay, well, if we're going to be distinguishing ourselves, then wouldn't we want to immediately address challenges like this once we have our own category? Of course we will. So when we're in the offices, we take that experience that you all have every single day and the challenge to access for your patients that poses. And we talk about our health policy position in that light. So we have to make this change because it is killing you all in practice every day. It is costing you administrative dollars that take away from your ability to provide good care. It challenges patients' access to the devices that they need for treatment and intervention. That is a strong talking point and a strong reason why we need to distinguish O&P from DME. So those pieces of health policy work that we're doing, looking for the quantitative and qualitative data that supports us in that way is also really important. And we've structured AOPA's team to be able to do that, both from a committee level as well as staff. So we've got 2 new staff members joining in the coming months, and one is a manager of federal and state policy, and one is a manager of health policy and research. And so, sorry, a manager of federal and state advocacy, and a manager of health policy and research. And so those individuals are going to be able to help us continue to build this area of work for AOPA, the work that we do for you all as members. So I'll pause there. I think we're at the end of our webinar, but I want to thank Terry for joining, and let us know if you have questions. If you can always reach out to us independently also, but we're happy to take some now while we're all together.
Yeah, I think there are no questions because you all did such a great job.
Well, I always hope that that's the case, but I mean, the reality is there's still so many pieces of this that I am learning. And I think, Terry, we say this like we learn something new almost every time we do this, and every time we go to the Hill, every time we have an opportunity to talk with people. Different staff in offices think differently, and they might want to know something that we've never even asked ourselves, and so we're just sort of building that toolbox constantly.
Yeah,
oh,
and I just wanted to add, from your perspective, you're sitting there thinking, what can I do? How can I help? And I just want you all to remember, I talk about this when we do the AOPA policy forum, that keep in mind that your piece of this puzzle is potentially to do three things. It's to educate. We're all here to help educate our Congress people about what matters most to us. We're here to advocate for those people who potentially don't have a voice or can't make it to DC or can't write a letter. So advocacy is a big piece of it. And what we do with our education and our advocacy work is all purposeful. And the purpose is to help provide access to care and devices that our patients need. And so when that's the drum that I've been beating for years, educating, advocating, and all for the purpose of access to care. So.
Thank you so much for joining, Terry, and for all your work and your constant for the OMP community, and your contributions have been incredible. And for those that joined us on the webinar today, I thank you so much. You took this time out of your busy day to learn more about ways that you can advocate, and know that, like Terry said, every single piece matters. Every tiny little outreach, every piece of information you can provide us in support of these efforts is influential and impactful, and never second guess that. So thank you for your time today. We are always available, Terry and I both. Joy, thank you for running the webinar for us. Appreciate that. And we will see you next month.
Thank you, Ashley.
Thank you, Terry. Bye, everyone.
Bye.